I enter my patient's room, I do my hand hygiene. Good morning, my name is Claudia. I'm going to be your student nurse today. And this week we're going to be going over our peripheral vascular assessment. So first I'm going to start off by asking my patient 2 questions. My first question is, have you experienced any leg pain or cramps in your calf areas?
No, I have not.
Okay. My next question is, have you noticed any swelling in your arms or legs lately?
Nope.
Okay. So the next portion of our assessment, we're going to inspect our upper extremities. So just by looking at my patient, I can tell that his skin is appropriate for his ethnicity. It's nice and pink. There's no signs of any pallor or cyanosis. Let's see. I can see that there is no swelling, no edema in the upper extremities. There are no lesions, nor or abnormal findings or abscesses. I can see that there is no clubbed fingers. For the next portion, we're going to go over our palpation. So first I'm going to palpate first I'm going to take a look at the skin temperature, and it's nice and warm to the touch. Our cap refill, if we look at our fingers here, is less than 2 seconds, so our circulation is good. Then I can also tell here that the nail bed is pretty much nice and flat. It's at about 160-degree angle. If it goes anything above 180 degrees, that's a sign of finger clubbing, which is poor oxygenation. Next, I'm going to locate my radial pulses. And I'm going to palpate them both at the same time and make sure that there's no abnormalities or irregularities. And I'm palpating for rate, which is within normal limits. I'm palpating for the rhythm, which is nice and regular. And the force is +2, which is normal, so it's not bounding nor weak or thready. Then after that, I'm going to locate my brachial pulses. And then again, once I've located my brachial pulses, I'm going to be assessing both of them for the rate, which is within normal limits. The rhythm is nice and regular. And the force is +2, which is normal. So after this part, I'm going to go over our inspection of our lower extremities. So if we take a look at our lower extremities here, both legs, I can tell that the skin is nice and pink. There's no pallor or cyanosis, no signs of redness. There are no abnormal findings or lesions, no varicose veins. Let's see. Also, the hair distribution is nice and even on both legs. There's no signs of any hair loss, which would indicate poor circulation. After this, we're gonna go, as we can see on our left toe, we have a little bit of a lesion here, but it's scabbing over. When did you get this little lesion on your toe?
About a week ago.
Okay, has it been decreasing in swelling and pain?
Yes.
Okay, because it looks like it's healing okay. It's scabbing over and it doesn't seem to be swollen or red or draining, so it seems to be healing normally. Onto our next portion, we're going to go onto our palpation portion of the lower extremities. So first I can tell that my temperature is nice and warm. if I check cap refill, it's less than 2 seconds, so circulation is good. I'm also going to be checking for any edema or swelling in the legs, which there is none. The skin is nice, clean, and intact. And I also am going to be checking our dorsal pedal pulses, which I will find I'm going to find both pedal pulses. And these are our dorsalis pedalis pulses. And again, I'm checking both of them at the same time for the rate, which is within normal limits. I am checking the rhythm, which is nice and regular. And then the strength, which is +2, which is normal. And now, after we check our dorsalis pedalis, we're going to go check our posterior tibial pulses, which is, if you can just put your leg up like this in front of the camera. So our posterior tibial pulses are going to be right under this little bone. Sometimes they're harder to find, but I'm going to be checking both of my pulses simultaneously. You can sit back down, I'm going to do it over here. So I'm checking both of them simultaneously. Again, for the rate, which is within normal limits, the rhythm, which is nice and regular, and the force, which is +2 and normal. And that concludes this week's assessment. Thank you.